morning, everyone, and welcome to the webinar on the IHI Call 11 on establishing Ortho and Cardiology Ambulatory Surgical Center in Europe. My name is Decima, and I'm going to be your moderator today. And before we start, I just want to share some information with you. If we move to the next slide. So firstly, we are recording this session and we will be publishing it on the IHI website. We will also publish the presentation slides. The call has been launched last week and all the links and details of how to apply have been published on the IHI website and also on the Funding and Funders portal. Another important point, if you have any question, please use the chat function on the right corner of your screen, and we will get to them at the end of the presentation. So today we have with us two presenters. So we have Paloma, she's scientific officer for this topic, and she's going to kick off with the presentation. And we also have Nadine Jamou from Zimmer Biomet, who is going to present the topic itself. And we also have Desmond, who is our legal officer to support for the Q&A session. So now I will hand over to Paloma.
Good morning, everyone, and welcome to this webinar on the call 11, topic 5. What will be covered in today's webinar? We will start with a few words on the IHI program, and then we will hear from the topic writer who will present the topic, so the leader of the Pre-Identified Industry Consortium. We will briefly cover the submission and evaluation process, as well as some tips for the interested applicants. But please note that we will not cover the rules and procedures because we will have a specific webinar taking place next week on the 30th of June, and the content will be also published online. Just a few words on the Innovative Health Initiative. We are a EU partnership in health, and this partnership is represented by the European Commission, meaning by the European Union, represented by the European Commission, and the Healthcare Industry Association as the private member of the partnership, including 5 industry association covering with COSIR the medical imaging, radiotherapy, health, ICT, and electromedical industries, with FPA and Vaccines Europe, the pharmaceutical and vaccine industries. The biotechnology industry is represented by Europa Bio, and MedTech Europe is representing the medical technology industry. What are our general objectives as established in the Strategic Research and Innovation Agenda? There are 3 main objectives. The first is to transform the health research and innovation into real benefits that can reach patients and society, to deliver safe, effective health innovation that cover the entire spectrum of care, and this is represented by the different industry associations, from prevention to diagnosis and treatment, and in particular in those areas where there is an unmet public health need. And last but not least, making Europe health industry globally competitive. This is one of our objectives as well. How are our projects generated in IHI? IHI is supporting projects that are created via an open and competitive call for proposals, and are projects that are cross-sectorial in themselves, public-private partnerships. So each project is a PPP at scale that is leveraging contributions from industrial partners, from the different industry associations, meaning COSIR, FPI, Vaccines Europe, Europa Bio, MedTech Europe, and where relevant, contribution from contributing partners. Please note that these contributing partners must be approved by the IHI governing board. There is a specific process for them to become contributing partners. And these projects are also leveraging funding from the public funds via the European Commission, and more specifically from the Horizon Europe program. The Strategic Research and Innovation Agenda of IHI is the guiding document and defines the areas in which IHI should work and helps to guide the organization decision-making, meaning which ideas should be transformed into call topics. And the focus of the CIRA in this sense is focusing on cross-sectorial approaches to facilitate the creation of new products and services to prevent, intercept, diagnose, treat, and manage diseases and foster recovery more efficiently. And the goal is to lay the foundations for development of safer and more effective healthcare products or solutions that can respond to unmet public health needs and that can be implemented in a real healthcare system. And it's important to mention at this point that the research that this support is at pre-competitive level, since there is no expectation from the industry, there is an expectation from the industry partners to work together at this competitive level. Before going into the topic content, let's see how the two-stage calls work. The call topic tests are prepared by the pre-identified consortium that have aligned to work on the same challenge and commit resources. Once approved by the IHI governing board, the call for proposals is launched. And then at the stage 1 of the proposal submission, the pre-identified consortium steps aside, and it's the applicant consortium who will prepare a short proposal addressing the challenges identified in the topic text. This applicant consortium is typically composed either by academic, hospital, regulators, patients organizations, SMEs, or even for-profit entities with an annual turnover of less than 500 million. This short proposal should be submitted by the deadline of stage 1, in this case is October 6, and will undergo a competitive independent evaluation process by a panel of experts. This panel of experts at this stage will prepare a ranking list, and only the first ranked proposal will be invited to the second stage. Then at this second stage, it will be the applicant consortium of the first rank proposal that will need to prepare the full proposal together with the pre-identified industry consortium that prepared the topic text. And this full proposal will be evaluated by a panel of experts, and if successful, they will be invited to prepare the grant agreement that ultimately will lead to the signature of the grant agreement. And before going into the details of proposal submission and evaluation and tips for the applicant, I would like to hand over to Nadine Jamus, who is the topic leader and will present the content of the topic. Thank you, Nadine.
Thank you. Good morning, everyone. I'm Nadine Jamus from Zimmer Biomet. I'm the Director of Market Access and Health Economics. I'm leading the industry consortium for this topic. I'd like to take you a little bit through establishing ortho and cardiology ambulatory surgical centers in Europe as a topic. Next slide, please. So we'll start off with the challenge. We all know that the EU has an aging population, and a rising burden of disease and disorders have resulted in increasing the healthcare cost and limited procedural capacity in operating rooms, as well as cath labs. Ambulatory surgical centers could potentially provide a solution for this problem. When I allude to ambulatory surgical centers, I mean surgical centers outside the hospital walls. So it's not outpatient within the hospital, but a separate entity outside hospital walls. So ambulatory surgical centers in orthopedics and cardiology could provide a solution to those EU challenges, as well as reducing the hospital-acquired complication, which is an issue in hospital care. Okay. But these challenges need to be addressed successfully to be able to provide high quality, efficient, and patient-centered care. The challenges are around reimbursement models. There's a lack of funding and reimbursement, limiting any financial incentive to shift procedures to ambulatory surgical centers. Stakeholder acceptance, especially decision makers, non-clinical stakeholders, are not always fully comfortable with the idea that ASC is a solution to the capacity and demand problem. Evidence, limited safety and quality of the data measuring performance, outcomes, and benefit of ASCs comparing to inpatient care, and human resource readiness. Healthcare providers are not trained, it's not part of their training, basically, to run ASC facilities in an effective and efficient way. The digital infrastructure has hurdles with data privacy, interoperability issues, and digital exclusion. And protocols are not standardized care models for different therapies, and limitations. There's limitations in patient-centered, evidence-based approach. Patients themselves may not be ready, as past experiences for some patients around outpatients have made them be a little bit reluctant for procedures in ambulatory surgical centers. And the home recovery ecosystem basically lacks that connection between the different parts of the patient pathway and the home care required post-surgery. So these are all the challenges. Next slide, please. But why do we need a public-private collaboration here? Basically, the diverse expertise brings together the varied sectors together, including providers, tech technology, us companies, academia, and policy experts. Pooling resources together in funding and technology and infrastructure ensures efficient use to maximize impact. And combining insights from public and private sectors will help innovation and development and the improvement of the digital solutions. The collaborative efforts will lead to development and dissemination of best practices, enhancing the quality and efficiency of healthcare services. There'll be complex challenges which we need to all sit together and understand the multi-dimension solutions that can achieve good results for the complex challenges, and a holistic approach between healthcare, academia, and the different sectors and social sectors, etc. Sustainability and scalability of the problem, public and private partnerships help create that sustainable healthcare models and can be scaled across the different regions and countries with a long-term impact to improve and adapt healthcare. Policy and regulation, collaborative efforts help influence healthcare policy and regulation, ensuring they are aligned with the latest innovation and best practice, as well as standardization of the protocols and guidelines, improving consistency and quality across the healthcare service. And finally, enhance patient outcomes. Patient-centered care is what we are all aiming for, and the different factors coming together will improve on that patient-centered healthcare. Now, the scope of this topic. Thank you, Paloma. The scope of this topic is basically addressing healthcare needs in focus areas. We are zooming into two focus areas. One focus area is in orthopedic, where knee and hip joint replacement surgeries can occur. And the other focus area is in cardiology, with cardiac ablation procedures, which also can occur in ambulatory surgical centers. And there is examples in selected countries and different parts of the world where this has been addressed. The shift to ambulatory surgical centers, so moving inpatient surgeries and treatments to ASC is the scope of the main scope of this topic in these two focus areas. Elevating the hospital capacity and issues, and reducing acquired hospital-acquired infections. And demonstrating the benefit of ASCs is the scope of this topic, looking at cost savings due to the absence of information around the infrastructure, enhanced healthcare resources utilization and reduced patient waiting times, patient-related benefits such as recovery, familiar home settings, reduced anxiety, faster recovery times, and decreased risk of infections. And the patient selection to ASC centers. Of course, we recognize medically not all patients will be the right candidates for ASC, but looking into what cohorts and what patient pathways are the optimum for the patient selections towards ASCs. So that's the scope of the topic. The expected outcomes of the topic. There's 5 expected outcomes of the topic to improve patient experience and satisfaction and address capacity and efficiency of those hurdles. The first outcome is consensus-based understanding. So basically regional and national experts committees driving the community involved and acting as reference opinion leaders, getting together and changing the trajectory, identifying hurdles, needs, and requirements for establishing ASCs within the European healthcare settings. The second outcome is training schemes and programs, the development of care pathways and enhanced recovery protocols and trainings for all healthcare providers involved in ASCs in orthopedic and cardiology, safe, scalable operational models that achieve high quality results. The third outcome is comprehensive framework, detailed guidelines on infrastructure, medical technology, protocols, and healthcare resources required for establishing ASC facilities. And the fourth outcome is the clinical database and economic evidence, creation of a clinical database that generates the evidence required and economic evidence as well to support European acceptance, standardization, and funding of ASCs as an integrated part of the healthcare services. And lastly, the interoperable IT technology solutions, integration of clinical data from multiple stages of the patient journey, development of related digital health solutions for patients' preparation, post-discharge management, and home monitoring. The expected impact, which these outcomes will hopefully bring, is a contribution to the IHI objectives. And I know there's a document on the SRIA objectives, and this will fit into addressing those objectives, driving cross-sector health and innovation for a competitive European health industry. The other impact is the infrastructure funding initiatives, establishing ASCs in orthopedic and cardiology as part of the healthcare system. Long-term strategy, planning and funding, healthcare providers, requirement numbers required, as well as recruitment and training, and implementing digital solutions and medical technology for efficient ASC services. New payment systems, developing coding and reimbursement that allows patient referral to ASCs based on medical and clinical decisions and not basically on capacity and payment systems. Sustainable networks of ASC, establishing national and regional ASC associations, regulation and accreditation, regulating and accrediting ASCs like hospitals, what is done in hospitals right now, and comprehensive digital solution is another impact where we support people-centered care with interoperable digital solutions that disclose entire patient treatment pathways and experience, including points of access to patient once they are discharged and in hospital and in home care. And treatment and database registries, basically creating a source of evidence, continuous evidence, enabling research, decision-making, and further development and improvements of ASC centers. Okay. Next slide, please, which is the expected contribution of the applicants. Now, applicants can come from different corners of life and hospital and healthcare providers. What is expected to bring to this project is leading and contributing to clinical studies, comparing inpatient and ASCs based on intervention, care models, different patient pathways, clinical protocols, and integration into home recovery services of those pathways for the patients. Academia and research institutes leading into evidence generation, safety, cost effectiveness studies. Digital health and IT providers deploying interoperable health information systems across care settings, tools for patient management, telehealth, care navigation, and clinical databases. Patient organization and insight into patient expectations, preference, concerns, communication strategies, support in recruitment for surveys and qualitative research. Payers and reimbursement bodies, guidance in defining clinical and economical endpoints relevant for reimbursement acceptance, co-developing innovative payment schemes and models. Policy and regulatory expert developing recommendations for ASC recognition, quality assurance, and standardization. And lastly, the professional medical societies and networks, endorsements, supporting standardization of care protocols, trainings, guidelines, dissemination of training materials and best practice within their societies. Okay. Now, in terms of budget, in terms of budget, the budget currently is the contribution budget from the industry consortium is in-kind contribution of 12,351,000, and the maximum financial contribution from IHI is up to 12,351,000. Next slide, please. So which are the companies in the industry consortium? As mentioned, I'm from Zimmer Biomet and I am the leader of this topic. Pre-identified industry consortium is also Medacta, Medtronic, J&J, Johnson & Johnson, Smith & Nephew, and Stryker. As mentioned, the focus areas is cardiology and orthopedic. Most of us play in the orthopedic area, with Medtronic and J&J will be involved in the cardiology piece as well. Sorry, I mixed the slides a little bit, so apologies for that. That's it from my side.
Thank you very much, Nadine, for the detailed explanation on the topic content. We will move now to the proposal submission and the evaluation, and after this piece of information, we will have some time for questions and answers, either to you or to us on the info we have. We will be sharing. Regarding the proposal submission, the applicants will need to prepare at this stage, at the stage one that they will be facing, will need to prepare a short proposal with the different elements that include the Part A, the Part B, and the annexes. So the Part A of the proposal is basically the administrative data, and this is entered via web forms in the funding and tenders portal. And then the Part B of the proposal is the narrative part, and this includes 3 sections: excellent impact, quality and efficiency of the implementation, that is mirroring the evaluation criteria, which are excellent impact and quality and efficiency of implementation. We really ask you to read the instructions very carefully, the instructions in the proposal template. Why? Because there are specific IHI criterion that are covered in the evaluation criteria as well. So there are IHI specific criteria for evaluation, and this is considered in the template. So this is why we really advise you to read carefully the proposal template so that you cover all the essential elements, and because there is a page limit of 20 pages, but it's really important that all the essential elements are there. And then also you will have to provide an annex with the participant type, to the type of organization that will take part in the applicant consortium. Regarding the evaluation process, what we can say about the evaluation criteria is, as I mentioned, there are 3 evaluation criteria: excellent impact implementation, and same structure as in the proposal template. Well, you will need to demonstrate the excellence, meaning the clarity, the relevance in the sense of the pertinence to the topic of the proposed objectives, and also to demonstrate the level of ambition and of your proposed work and how it goes beyond the state of the art. And you will have also to demonstrate, the robustness and the soundness of the proposed approach and methodology to deliver on the proposed objectives. This is for the excellence. For the impact, the credibility of the pathways to achieve the expected outcomes and impact that are specified in the topic test, and also a demonstration of the scale and significance of these contributions thanks to the project. As for the evaluation, let's go first to the third criteria before talking about the expert. The quality and efficiency of the implementation. You will have to have a high quality work plan. The main elements, because it's a short proposal, but the main elements of the should be considered in the outline. It has to be effective. It has to be work packages logically connected, linked to the objectives, and the capacity and the role of each participant should be demonstrated, and the extent to which the consortium as a whole brings together the necessary expertise. The threshold for the individual evaluation criteria is 3 for each, meaning 3 for excellence, 3 for impact, 3 for implementation, but the overall threshold is 10 out of 15. So it's not only necessary to reach the individual threshold, but the overall threshold, meaning that a proposal that is scoring 333 is reaching the individual threshold, but will not be, will not be considered above the general threshold, and therefore will not have any chance for funding. And also another comment that I would like to make here is that because this is a 2-stage call, meaning that there will be only one proposal proposed for funding, not proposed for funding, to go to the next stage, to the stage 2. So it's not only needed to go, of course, overall the threshold, but to have a very good threshold, because there will be only one, so the highest ranked. So this is why it's important really to take care of this, the three elements of the evaluation in consideration. I didn't mention, but of course, the evaluations are taking care, we have external experts. It's not the IHI program office. We are the ones organizing the whole exercise, but we have a panel of external experts, and with that can form a really multidisciplinary team, because they will need to cover the different aspects and the different subjects covered in the topic text. So I will finalize with 2 slides with some tips for applicants. Well, always our first tip is to read all the core relevant material, and in particular the topic text. Why? Because of course this is a key document for preparing the proposal. As you can imagine, the topic text is the result of many meeting, discussions, negotiations. So every word matters in a topic text. So please read it carefully. Try to start working as soon as possible on the applicant consortium, and with the idea in mind of a future public-private partnership. So at the first stage, it will be only the applicant consortium, only the first rank proposal that will move forward to develop the full proposal with the pre-identified industry to make the full PPP. So you need to take into consideration very much what the industry is bringing, so that you don't, in principle, duplicate the expertise, but you ensure the best possible match and complementarity. And so the expected expertise and resources that are expected from the public consortium size need to be considered carefully to gather the request expertise to ensure this cross-sectorial approach when establishing the PPP in the full consortium. And as for the regulatory impact, please consider and plan for it. See also, we have a guide in our website, but it has been already mentioned in the topic presentation that policy and regulatory expertise is requested, including engagement with HTA bodies and regulators to support the project sustainability. To find project partners, some useful resources that you may consult, have access to. Use the EU Funding and Tenders portal. There is a partner search tool, and here you have the link. We also advise very much to get in touch with your IHI national contact point. They are very knowledgeable on the program, and they can give you very good tips and advices. And of course, network on the social media. By the time that especially by the time that the call is open, there is a lot of activity around. And with this, I would like to move, to give the floor to my colleague, to the legal officer of IHI, Desmond, that will present a slide on the eligibility for funding. Desmond, you're welcome.
Thanks, Paloma. So good morning, everyone. This slide is only going to take a couple of minutes, but we've included it because Call 11 has some specificities in relation to the eligibility for funding, and we felt it was important to raise it. So before I go into the detail here, I would just refer everybody who's on the call, who's looking at getting involved in a proposal, that we have the full rules and procedures webinar for Call 11 next Monday. And the links are obviously in this recording, and they're also on our website. But if you are looking at getting involved in a proposal, obviously you'll need familiarity with the IHI rules. In the webinar next week, we'll talk about eligibility, we'll talk about the application, we'll touch on some rules of the grant agreement, we'll talk about IP considerations, we'll talk about the consortium agreement, and it's extremely useful. It's usually a well-attended webinar. So just for the purposes of this slide, as I said, call 11, we have a few specificities in relation to eligibility that we just want to flag for everyone at this stage. So if we look at the table, we're identifying 4 countries here that basically they have some differences in what you might expect. So for UK and Canada, who are treated together, and they're treated together because of the date of their association to Horizon Europe, in call 11, for topic 1, legal entities from UK and Canada are of course eligible to receive funding. But for topics 2 to 5, which includes this particular topic, the UK and Canadian entities are not eligible to receive funding from IHI. There are options, we'll come to that in a second. And then Switzerland and South Korea, legal entities from those 2 countries are not eligible to receive funding from IHI in any of the call 11 topics. Now, that said, as we say at the bottom, there are ways by which legal entities from those countries can seek alternative funding. We would recommend that they actually contact their governments. For example, Switzerland has a very robust funding mechanism for legal entities when they can't receive funding from IHI. So if you're from Switzerland and you want to take part in any of the proposals under call 11, you should contact SERI immediately. And we've had some informal contact with SERI in relation to that. Maybe more concretely for the UK applicants, because I can see a lot of UK participants on the call. We have specific information from UKRI and from Ms. Jo Frost, who's the UK national contact point. And she has specifically asked us to mention that if you are interested in taking part in a proposal under IHI call 11, regardless of the topic, but particularly topics 2 to 5, you should contact Ms. Frost at the address there, and basically then you'll be able to register for the updates and the advice that UKRI they're in the process of marshalling and giving advice to everyone and how they can participate in call 11 if they are from the UK. So that's this slide in a nutshell. In the rules and procedures, we'll talk more next week about the mechanics and the reasons why. But for everyone on this call, just so we don't divert from the scientific emphasis on this particular call, we're not going to go into too much detail here. Thanks.
So thank you, Paloma, thank you, Desmond, and thank you, Nadine. I will take it from here. So just before we move on to the Q&A session, I would like, as Desmond just said, to promote the 2 last webinars that we will have for call 11. So we'll have the rules and procedure Monday morning, and we'll have the last topic on Monday afternoon. So if you're not registered already for this session, I would advise you to do so. I can see that we only have a few questions, so I just want to emphasize the fact that this is your only opportunity to get the information directly from the topic writer. So if you have any question, please drop them into the chat function box. So we can start with the first one. For the database, can you please explain what you would like to see and the developments?
So this is a question for me. What would we like to see in terms of what exactly?
It's regarding the database.
Oh, the database. Sorry.
Yeah.
The database, think of it as a place for all clinical and economic endpoints which could be collected to be able for any researcher to go back to this database. And that database will be a pool of all evidence where a research question, the researcher will have a research question and they will find the evidence needed in the database to extract the evidence required to answer any research question. So a collection of clinical and economical endpoints collected from the patient journey, basically.
Thank you. The next one is more for the IHI office. So could you please inform us about partner search? Will there be a matchmaking platform for this year's call? So I can tell you that for call 11, we won't be developing any matchmaking platform, but you can refer to the slide presented by Paloma in her presentation. So just for you to know, the slides will be shared just after this webinar, so you will have access to all the links. And a good resource, as my colleague just put it in the chat, is the partner search tool on the Funding and Tenders portal. So all the links will be shared with you just after this webinar. The next question is, what kind of regulatory impact is desirable by the end?
Regulatory impact. So
Yeah.
At this stage, ASCs are not considered as separate entities, I think, for regulation, for any of the sort of registration. And this is, I think, required to make sure that an ASC center is treated like a hospital with all the regulations around hospitals, the same kind of regulations around hospitals with, of course, changes because it is ASC. So for full regulation, quality assurance, registration, etc.
Thank you. Someone else is asking if existing hospitals essentially opening a new ambulatory department for ablation and knee hip replacement surgery would qualify as ASC, sorry.
I mean, we are looking at the idea of having ASCs outside hospital walls. So if it's disconnected from the hospital, yes, but if it's still very connected to the hospital, then no.
Thank you, Nadine. The next one is, are further developments and validation of novel technologies like smart connected knee prostheses with integrated sensors for improving post-operative and rehabilitation phases in the scope?
Well, I guess any new technology which will improve patient outcomes in that kind of setting could be in the scope.
Okay. Now we go back to the database questions, and the person is adding, are you also looking for options to work together with stakeholders and test users?
I'm not sure if I completely follow that question.
It was referring the first question on the database.
On the database, yeah, looking for options to work together with stakeholders and test users. I mean, I guess so. Anything with the stakeholder, because I mean, the stakeholders, if we're referring to clinical stakeholders, these are the ones who will be collecting that the data. So yes.
Thank you. I don't see any other questions in the chat. Oh yeah, there is a new one. What emphasis do you place on development of follow-up workflows after the procedures?
A lot of emphasis. I mean, the purpose of ASCs is to allow patients to go home on the same day and be able to carry on at home with recovery. And hence, it's all about the patient pathway all the way to end of recovery. That end part will be at home. So very much so an emphasis on that development.
Thank you. There is no other new question. Yes. How many test areas do you advise to test with?
So test areas. So it's orthopedic, hip and knee, and cardiology, cath labs. But in terms of is this in terms of numbers?
I don't know. Can you clarify, please, your questions? About locations.
So, I mean, we talked about focus areas in terms of locations. I think will that not depend on the applicants?
Okay. I don't see any new question in the chat. No, I don't see any new questions in the chat. I think we can close this webinar. So I would say thank you very much to Paloma, Nadine, and Desmond. I will thank you all for your interest, and we wish you good luck with your proposal. Have a nice day. Thank you. Bye-bye.